Thank you very much. So, my dad was a lawyer and a judge, and when I was young, he used to say to me, "You should follow me, a profession that never goes out of style." And I was listening to all of you talk, and I was like, "Boy, he was right." And then I chose to be a software developer and change the world, and I'm so glad I didn't listen to my dad. That was my second thought. So that being said, I'm not going to talk about legal, I'm going to talk about healthcare, and I'm going to talk about people. Before we talk about people, I'm going to talk about one individual that I really drove this whole picture. So I've been in healthcare all my life, spent my entire career working on the insurance side. Yes, I'm the CIO you all hate because I make you go through eligibility, enrollment, referral management, pre-authorization, adjudication, all the things you hate. But that was my job, to do healthcare administration. And then I also had the privilege of working on two major healthcare initiatives, one launched by President Bush called health savings accounts. Everybody predicted they won't work. 20 million plus people use it every day. I'm very proud of that. And then I worked with President Obama's team on expanding Medicaid in many states and implementing the integrated eligibility systems. So it's been quite a ride, quite a journey. Put all that behind me to start Solve.Care, a healthcare administration and payment platform on blockchain. And a lot of my colleagues said, "Are you nuts? You're jumping into Bitcoin. This is all crazy stuff. Why would you commit 25 years of your career to something that nuts?" This is not about Bitcoin. This is about decentralization that can re-energize the patient-provider relationship in a way that I, the insurer, can delegate without losing control. And that's the vision behind our platform and idea. But I want to share with you why that even matters, why even do something like this. And the reason for that is my 3-year-old son. So about 18 months ago, he got very ill, and I had all the big names on speed dial, those who deliver care, those who pay for care, those who administer care, and yet this is a nightmare for us. Despite all our resources and a quarter century in healthcare, managing his care is a full-time job. Coordinating therapists, neurologists, pediatrician, and so on, with all the fancy systems that I was so proud of, none of that really enables the care coordination, effective access to care, timely payment, and reconciliation. Whenever I go home from the road trip, I have a stack of bills about 40 feet high on my kitchen table, and my wife is like, "Help, I have no idea what to do with these. Which one do I pay? Which one do I not pay? Which one has an EOB? Which one doesn't have an EOB?" And that's ridiculous. And the fact that with all our centralized systems today, we cannot facilitate access to care, we cannot calculate the cost of care, we cannot pay for care on a timely basis, and we sure as heck can't reconcile. So that really brought me to this realization that centralization is a fundamental issue, and integrating all these systems on HIEs and HIXs, fancy acronyms for integrated systems, just doesn't work. And we spent $30 billion offering EHR to every physician in the country, and that didn't change anything fundamentally. So that was my vision, to say, okay, let's do something that actually would work for my son, for my wife, and for all of you. So we decided to build a platform on blockchain from the ground up. I'm an IT guy. I grew up in the IT sector in healthcare, grew into management, and learned to manage risk and actuarial issues and clinical utilization, care management, all the wonderful things you do. But in the end, I'm an IT guy. And I started to ask the question, when will these systems be upside down? When can we actually delegate authority to the patient instead of controlling more and more in our centralized systems? And therefore, we designed the idea of a personalized care platform on which patient providers can transact directly with each other with my authority delegated to the patient. Sounds simple enough, but its implications are very profound. Many of you have heard of provider directories, right? Sorry, I'm going to go back. So when you access provider care, when somebody gets sick in the family, you go download a provider directory, you start searching for a provider randomly. And you throw a dart and say, "Dr. John Doe sounds good." And you call him, and he's not available. And then you call the next doctor, and then you call the next doctor. Finally, you find somebody who can see you. And if he has to refer you to a specialist, the same drama starts all over again. That's wrong. It's a completely broken model. What we need to do is to reverse. I, as an insurance company, should give you a token. And any doctor in the room who has availability should be able to accept that token and therefore sign a dynamic rate contract with me. I'm guaranteeing payment, but I don't want to control your access. The reason we do it the way we do it today is historical. We do it because we want to manage cost, eliminate fraud, waste, and abuse, make sure utilization is fair and just. But in doing so, we've actually made care difficult to get and very, very hard to pay. So you end up with this something called medical loss ratio, which is the amount of money you spend on healthcare not delivering healthcare. And government tries to control it, insurance companies live or die by it, but in the end, that's the number that we are trying to get rid of, which runs into hundreds of billions a year. So what's our vision? Our vision is to actually use the chain as a delegation of authority network, where I, as an insurance company, or as a Medicaid administrator, or as a Medicare program manager, or the CHIP administrator in a state or federally, or an insurance company, or even a large hospital system, or an ACO, there are a lot of different models of care in the US, can build a network trusted chain on which people can register. So given that, the idea is that I can issue, instead of a plastic enrollment card that you get and throw away and then you don't remember where it is when you need to go see the doctor, I issue you a token that actually calculates your out-of-pocket premium, your copay, your co-insurance, your deductible. And when you go walking around the city looking for a doctor, when they accept it, they not only accept the rate contract from me, they also accept your responsibility to pay them. And when you leave them, that coin transfers to the doctor's wallet and becomes a payment coupon. Now they are guaranteed real-time payment in the form of a traditional EFT in the back end. So the idea is to flip the model of care and care access from me telling you who you can see, me telling you what services you're pre-authorized to do or not do. I'm giving you the token that tells you and your doctor what the two of you can do. So that is the fundamental premise. And if we do that, we blow up what's called provider networks. We blow up provider network boundaries. I, as an insurer, don't need to pre-negotiate rates. I publish my rate, you accept it. If you accept it, I pay you. If you don't accept it, the next doctor will. It absolutely changes the way healthcare works. What's really exciting is that we thought this is a US-centric model, but we started to build it, and now our greatest adoption and attention is coming from all over the world. Governments in Europe, in Asia, are saying, hey, this is a fantastic model for me to delegate authority to my patient population, whether it's a group of, of any population, children or pregnant women or poor or disabled or blind or aged, all of those populations can have their own specialized token. In the US, that could be a specialty population like the veterans. It's a great example of saying, how do we let the veteran go seek care outside the VA hospital without breaking the veteran's boundaries? So that's the fundamental issue we're trying to solve. I get asked the question, why blockchain? Couldn't do it any other way. Tried every other way, it doesn't work. Centralized systems, integrated HIEs, and integrated eligibility is essentially propagating the fundamental problem that I am the central clearinghouse of care. And I really don't want to be. As an insurer, I don't want to be the policeman of care. I just want to facilitate and pay accurately. And I want to make sure you don't abuse the right to use care. That's what we're after. So with that said, we have designed, our platform is somewhat complex. We have 2 digital tokens. And I want you to understand them because there's a lot of talk about tokens and why they're needed. And you really don't need tokens. Yes, you do. A token is a guarantee of some authority that has been delegated by somebody to another person who has the portability of that token, and anybody else can accept it. So we built a token called Care Coin, which is backed by our client's reserves, meaning an insurance company issues a Care Coin on our platform, thereby guaranteeing the provider or the physician a payment. If you accept my Care Coin, I will redeem it for X dollars. The beauty, though, is Care Coin can be programmed to change value. In other words, if I pay the Care Coin for receiving an office visit, it's $100. But if I get a surgical appointment, it's $1,000, and so on. So that's the Care Coin. And then we have a platform utility token, which actually every single wallet holder, card user, coin issuer has to pay the gas or the fee for the platform. And again, the idea being that I, as a provider, I, as a patient, can subscribe to the wallet myself, or I can subscribe to it through my sponsor, employer, or insurance, or government. With that said, here are the 7 functions we're looking to decentralize: eligibility and enrollment in healthcare programs, scheduling and appointments, which is actually a very tough problem to solve, pre-authorization and referral management. I don't want to tell you who you can see as a specialist. I want your doctor to issue his token to the specialist. I don't have to clear that. Benefit administration, billing and payment, quality measurement, utilization management, and medical necessary transportation, which applies in many of the specialty populations like Medicaid. That being said, we have signed a major client in the US to deliver our first version of the platform to them in May. 5,000 physicians and roughly 300,000 or more patient wallets, which allows the 2 of them to interact with each other directly on a private chain issued by our client. The client will then sponsor care wallets for everyone. That's the fee we receive. That's how we make money. And then finally, there are hundreds of other clients like that in the US alone, not to mention the worldwide traction that we are already seeing. So 4 goals: delegate authority to the patient, prompt payment for providers, which is accurate and real time with a dynamic rate contract, dramatically open up access to care, meaning supply-based, not demand-based, not supply-based care. I want to put my son's need for ophthalmologist visit on the chain and let every physician in 30 miles accept that appointment with a token attached to it instead of me calling randomly doctors to find one who will see him. And finally, reduce the administrative and utilization costs. It is very hard to abuse a set of events on a chain that can never be modified. I can always come back and review to make sure utilization and delivery and payment was accurate. A little background on myself. I've already mentioned I've been in healthcare all my life. The company is based incorporated in Estonia, doing business worldwide. We are doing a pre-sale right now with a goal to do a token sale. And to the lawyers in the room, absolutely agree, better comply with the SEC laws if you want to conduct fair and accurate business around the world. So that's what we are doing. If you have any questions, I'll be around. I would welcome your thoughts, comments, criticism. If you are in healthcare, I'd love to debate with you how this will change healthcare upside down. And I welcome your feedback. Thanks very much.